This is Deborah Atkinson, and you're listening to the Voice for Fitness Professionals podcast, where I share programming, marketing, and promotion strategies that are easy, enjoyable, even fun, so you can create a business and a life that you love. And today we're talking all about women again, but we're also talking about specifically pregnancy, before, the after, and all the special effects that are true of women who are in that phase of life. And I'm thrilled to have with me kind of my partner in crime. And we'll talk more about that as we go through. But this is Danielle Spangler, creator of Core Mom, which stands for Corrective Obstetrical. And I really tripped on that the other day too. Here we go again, related exercise. And is also a nationally known speaker, presenter, and contributing writer for the Medical Fitness Network and Medical Fitness Education Foundation. She has been researching in the prenatal space since 1995. She owns her own boutique fitness studio and is parenting 3 children together with her husband. In addition, she's authored prenatal programs for continuing education for the National Academy of Sports Medicine and Fitness Learning Systems. Danielle, thanks for being here.
Thank you so much for having me.
This is so exciting. And so as I read your bio, it always trips me up because back in 1995, in January, that's when my son was born. But I remember distinctly in 94, as I got pregnant, the ACOG guidelines changed that year. And I'm sure they've changed once or maybe probably twice since then again. But I was so excited because finally it kind of lifted that, don't let your heart rate get over 140. And I'm like, God, take that, you ladies who were critical.
Yes, definitely. I mean, ACOG came out with their first set of guidelines in the mid 80s, and they definitely came out with a few more guidelines in 94. And it really wasn't, though, until recent years in 2015 that they actually came out and recommended exercise to every woman who is expecting, barring any pre-existing medical conditions. So there's definitely been an evolution. We are still noticing that they are recommending very general guidelines. They're not very specific, and that's where the gap is. And that's where we are trying to educate both fitness, medical professionals, as well as the client on what appropriate exercises specifically look like during and after pregnancy.
So good. So good. And I love this subject. I mean, it's like, gosh, not to be morbid, but maybe. So as we record this is Friday afternoon, you know how it is, everybody, but it's like, if you're going to sell caskets, you're always going to be in business. So if you're going to work with women who are pregnant, you're always going to be in business, right?
That's true. Very true.
Okay. So it's been a long week, clearly, but let's start with this. What are some of the most common mistakes and myths with exercise during pregnancy and after delivery? Because I think this is such a good one. I think there are a lot of people who, are trainers or health coaches, and I love to work with this population, but there may be also an equal number of people who are like a little fearful, of hurting women, of doing the wrong thing, and maybe err way on the conservative side. There's just a lot of things that you could get criticized for. And I think that's a part of the fear too. But how do we unpack common mistakes?
That's a very good question. There are a few, I would say, basic myths that are still running around, even though we've tried to debunk them over the years. I think that you nailed it when you said that a lot of trainers, fitness professionals are a little fearful of working with this group. Also, a lot of, as I mentioned, medical professionals, as well as fitness professionals, are not necessarily staying on top of the updated guidelines through ACOG, so they may not be aware that they have evolved and changed. So they might still be stuck back in the 80s or 90s with some of the recommendations. One of the biggest myths, and you mentioned it earlier, was the heart rate over 140 beats per minute, which used to be the standard. We were told to not raise a woman's heart rate above 140 BPMs. And actually, that was not even lifted until 2002. So even when I was a fairly new trainer in the late 90s, that was something that I was told we had to comply with. But knowing that obviously athletes have, more efficient heart rates, in other words, and we just didn't make any sense. So we started going more the way of perceived exertion. So that's definitely a myth that some people still bring up to me. Another myth is that during the third, or actually starting in the second trimester, women have been told that it's dangerous for them to lie in a supinated position or on their backs.
Yes.
And that is a myth. The only thing that is noticeable is if someone has gained a significant amount of weight, and everyone carries their baby differently, they might be uncomfortable. And what was at risk back then, or what we thought was at risk on lying on your back, was decreased blood pressure and especially decreased circulation to your limbs. And that could cause you, more than anything, lightheadedness. There was also some question that the pressure of the uterus on the inferior on the inferior arteries,
Yeah.
could potentially also affect circulation. But again, that has been debunked. It's just a very individualized recommendation. So some of my clients are able to stay on their backs throughout all 3 trimesters. I wouldn't recommend keeping them there for a prolonged period of time just because of comfort level. But there's nothing really dangerous that we know of, that there's no reason scientifically they cannot be on their backs. And some other things that we've also debunked over the years is that pregnant women should not rotate or use their abdominals. And, it's impossible not to use your abdominals for anything. Clearly, if you've ever had abdominal surgery, you know how much we rely on our abdominal strength. What the difference is that we have to teach women how to engage those muscles properly and to look out for things like coning, which is the connective tissue naturally separates. And if a woman is not engaging her belly muscles properly, she could be creating too much intra-abdominal pressure and thereby coning or pushing outward on that connective tissue, which can create more of a diastasis after her baby is born or in her third trimester. So we want to teach women basically how to engage their pelvic floor and core muscles using breath work, using proper exercises, which we can get into later. I also teach women how to very carefully get out of bed or get from a lying position to a seated position, which they wouldn't go upright using their stomach muscles. They would rotate to their sides and push themselves up. And that gets me on to the rotation or twisting topic, how that is also something that a myth that we commonly think that a woman should not rotate. And again, that's not realistic.
Right.
That's not functional. We all rotate. We bend forward. We move in ways that are just not linear. So it's important to let women know that this is a myth. They're not going to hurt themselves. More importantly, they're not going to hurt their unborn child. But to obviously use caution, listen to their bodies, and understand again how to exercise in a functional manner so that it mimics their everyday activity, and they're going to strengthen their bodies and reduce themselves to injury.
I love that. And right away when you started saying there's trainers who still hear this or believe this, and I want to kind of touch on something, and I don't mean to throw any of our medical community under the bus, but I also know that a lot of doctors are still repeating very old ACOG guidelines. They're still telling a lot of their patients,
Yeah.
don't get your heart rate up, don't do this, just walk, don't do. So, I think some of it comes with potentially maybe the older and more conservative both. And I don't mean to say you have to be conservative if you are an older doctor, but I
Correct.
think some of that becomes habits, and they may themselves not be keeping up with ACOG guidelines, and it can come from there. Do you find that to be true sometimes when women come to you and they've heard this from their doctor?
100%. I would say one of the misguided expectations or guidelines that doctors do give their clients or their patients rather during pregnancy is they usually say, well, if you've been doing a certain activity, there's really no limitation or reason why you can't continue it during your pregnancy. And they definitely say that after the baby's born. And when they give you, you usually go to your OBGYN for a 6-week checkup just to make sure everything is looking pretty good. And I'll talk about this later, but rarely do doctors actually screen you for any pelvic floor dysfunction. But they give you an overall look, and they make sure that you are not having any physical issues that are not, they're just superficial. And then the doctor may say, oh, you're ready to go exercise again and do anything you did pre-pregnancy. So women hear that and then they think, oh, okay, I used to run. I think I'll go back to running, or I did CrossFit or whatever it is. And during pregnancy and after, we know that our bodies have gone through significant hormonal, structural, connective tissue changes, and we have to be very mindful about that. Sure, there's women that can run marathons in their pregnancy. Do I advise that for the general population? No. And I really don't advise that for even an athlete, because we still don't know what the repercussions are later with that impact and pressure on the pelvic floor muscles. But, more importantly, we just have to keep empowering women, but telling them they should exercise, but in the right way. I think that walking is one of those really easy things to recommend. And that's why a lot of doctors do it, because they realize that walking assumes very little risk, rather than going to tell someone to strength train, which can be very, broad, and more explanation is required. So when a doctor says to their patient, go walk during pregnancy, that can actually be contraindicated, especially as that woman is in her 3rd trimester and her femurs may be externally rotated. She's having more of a pronounced anterior tilt to her pelvis. So you can imagine her hip flexors are really tight, her glutes are not activating, her hamstrings are overstretched. So walking may not be the best thing for her. And especially if she's having any pelvic floor dysfunction, it may enhance that more. And if she's not using good technique with her posture, then of course it's going to affect the way she walks. So I would say to everybody, the best thing you can advise a pregnant woman to do during her pregnancy with exercise is to do gentle pre and postnatal specific functional strength training that can be done with any type of equipment. But again, you want to mimic your everyday movement that includes bending, reaching, rotation, squatting, and lunging. You want to help her engage those muscles of her pelvic floor and her core gently and safely. I would not recommend impact, anything where you're jumping or running. I would not recommend anything that puts a lot of stress on the abdominals. Intra-abdominal pressure is a definite no-no. And I would just assess it case by case. But I would say more than anything, women should be engaging in some sort of strength training. Otherwise, something like swimming is great, dependent on the person's form and technique, but I'd have to see them to know exactly to prescribe walking, and then give them more general guidelines like how far they should walk, how intensely they should walk, etc. So, anyways, I think the question, I'm sorry, I went on and on, but I think the question was, as far as medical professionals go, I definitely agree. They need to, I'd say the safest thing that they should do is to refer to either pelvic floor PT. Well, I believe that pelvic floor physical therapy should be an automatic prescription for all pregnant women and new mothers. just so we understand what is going on an internal level. And then another prescription should be given to a pre or postnatal fitness specialist that can really customize an exercise program and guide them in the right direction.
Great advice. Yeah, so much to unpack, and I know it's just, where do you start? But it almost lends itself to, great marketing opportunity if you are certified, you've gone through a course, you're a specialist in this area and you really want to work with them. The opportunity might be first in going in saying, um, to a doc and say, can I come in and just do a presentation for your staff? And it feels like a good fit. I would be happy to be a resource for your patients,
Yeah.
but in a way you're doing it to potentially educate them and be able to do a presentation on most recent guidelines really suggest this. And you're telling them the myths for their own benefit as well as their patients. Love it.
I
Okay.
think we're just at the beginning of all of this. I think we're about to, it's a really exciting time because I think that we're understanding that this is a very underserved population and that their needs are very different. And we need to have more fitness professionals and medical professionals ready to go and ready to give a treatment plan. Like we give treatment plans, recovery plans for every other medical condition except for pregnancy and delivery. And so I think this is a very exciting time to be a part of this kind of empowering movement for women and their bodies.
So agree. Just from adolescence to postmenopause, which is, why you and I are hanging out a little bit more. So we should let listeners know, we're having a party over here and you're actually invited. So you and I are a part of a trilogy of a team coming up with a course that will, certify people who finish it, the whole thing, as a specialist in women's overall health. And the third partner in crime with us is Michelle Maddux, who's going to do the adolescent edge and working with youth, but specifically females, because different hormones, different body composition, different metabolism, and different socialization all the way through. It's really a specialization all on its own. So, Danielle, for listeners, I mean, why do you think this course is so important to the health and fitness professional?
Well, I touched on it a little bit, and I did mention that pregnancy, pre and postnatal, was an underserved market. But I actually believe that of all women of all phases in their lives, you've mentioned this before that more research, or actually most research done for fitness, is done on male bodies. Most programs that are around, most fitness programs and equipment is designed for male bodies. So we're really starting to understand. We've known, obviously, we're very structurally different, but we understand more about what the female lifespan looks like and how her hormones affects her. And it's a really important deep dive to take what she's going through physically throughout her life, what she's going through emotionally, mentally. And I think that the more people that are aware of the vast differences are going to be helping improve the quality of life for their female clients and female patients. And I just also think that, we're again in this unique time where women really, really want to take care of themselves. They want to know more information. They understand that they have never, some women have not put themselves on the top of their priority list. Everybody else is coming first. So I think this is a very empowering time. It's really important to know how are we working these young adolescent girls, because we understand that a lot of them are overtraining or not training properly enough, or doing the right things. And if we can get to them as young women, hopefully we can set them up for success for their life. So it'll be interesting to see this generation of women that may be trained differently from adolescents, and how will it affect them perhaps if they do decide to get pregnant. How will it affect them in their older years when they start to go through menopause, and see if that kind of training makes a big difference because we suspect it will.
Definitely. Yep. And, as you and I, are into, the MedFit network, and we're developing and relaying webinars and classes to educate, it's like we're passing the baton. So as you talk about, during pregnancy, issues can come up with pelvic floor dysfunction. And then those are the people that I see who are saying, I've got, prolapsed uterus or prolapsed bladder, or I've got pelvic floor function issues. And,
Mhm.
and I think if we can get to it early in a woman's life and empower her, then later in life, we get there already more resilient. We don't have this one more thing we've got to deal with. We're just dealing with age, as anybody would, but we're going to enjoy it a heck of a lot more.
Yes, I agree. And I think that for many years, women have been told that certain things are a normal part of the aging process or a normal part of giving birth. But we have to reverse that mindset and explain that having pelvic floor dysfunction, including things like prolapse and incontinence, are not normal. They should not be considered normal, and they are completely preventable and treatable. So we have to consider this is a muscle, and we need to learn the muscle group of the pelvic floor and how to teach people what it is and what its function is and how to exercise it properly.
Love that. And I think really love, what you're saying in terms of this is normal. That doesn't mean, or it's not normal, it's common. It's not normal. And we confuse those two words. And I think, she does too. And she looks around and says, well, everybody else has this too, or so many other people have this too. It's more normal than usual, but not. It's more common, but doesn't have to be. Great statement. Let's do this for listeners, because I really think we need to. Why is this course that we're creating, in your opinion, and I'll go back and offer my 2 cents. Why do you think this one's unique compared to other courses out there?
Well, from what I've seen that is out there right now with pre and postnatal fitness, I think there are some great courses available. I do think that we offer a unique perspective because we are following the lifespan, and usually it's only pre and postnatal, and there is very little discussion about what happens to a woman prior to that or after that and how it affects her quality of life, like we've touched on. I have not seen anything that has touched on all the 7 different hormonal phases and how it affects muscle function, etc. So, and how different training techniques are effective or not effective during all these 3 phases, or excuse me, 7 phases, thinking about the adolescence, pre, postnatal, and then the menopause phases. So I think that we are bringing a very unique course to the table, especially the 3 of us having such great expertise in each component. Instead of having one person author the entire course that maybe knows very little about 1 or 2 of the topics, we are each focused on our lifelong passion and what we each really truly know. And I think that the people who are taking our course are going to get so much out of that because they're learning from 3 individuals who have worked specifically with their population for, at least over a decade, some of us 2 decades or more. So I just think that we bring not just the science to the table, but we also bring the experience, and that says a lot.
Yeah, I can just say, I guess, ditto to everything that you mentioned. I think I would add to that sometimes I've seen courses offered that are like, in retrospect, an eclectic collection of articles and courses put together that were not intended to be a singular course or specialist or certification. And I think that's one of the unique things is we're starting this and planning this so that there's a logical progression from one to the next to the next. And that's not to say, and if you're only interested in adolescence or, a woman's life before, pregnancy, maybe she doesn't even have an interest in childbearing, that might be where you want to focus and who you're working with. You may only be interested in perimenopause, menopause, and postmenopause, which is a large chunk of life, by the way. And you could take them standalone, as well as the, prenatal, pregnancy, postnatal. But, if you're really interested in the entire lifespan and maybe you want to start somebody young and keep them for a long, long time, then you have that opportunity. And I think statistics are also really important here. Women make up about 78 to 80% of all personal training clients. That's phenomenal. So she's going to be at some age and stay. So I think what makes me really proud of the fact that, this course will be offered is it's looking at everything as okay, I'm going to hand the baton off, or actually I'm not, I'm the tail end of the line, but you're going to hand the baton off to me. Hopefully nobody's in perimenopause becoming pregnant, because she's probably not going to love that, but it's happened. But love that. And I'm really excited to launch this. So just in case you're interested, I will let you know that at medfitclassroom.org, I will put the link in the show notes. So the course is just in development as we're recording this and releasing it. But I will also be touching base with Michelle at another time, talking about adolescence a little bit more and talking about the ringleader, the wizard, Lisa Doherty, who is actually the founder, and the brainchild was Medfit Network was hers. Talk about why she's so passionate, which is like, girls get this done kind of passionate right now. About bringing this together and being, the one who houses this specialist. So, Danielle, last question. I would ask everybody this. Is there a question I should have asked you specifically? I've got you in the house being able to talk about prenatal, postnatal fitness. Anything I should have asked you?
I think we've pretty much covered everything. I feel like we've talked about, covered everything that we can in terms of how women we're trying to empower women. We understand and recognize that we are trying to change the tide so that when they decide to have children, they understand how their body works. And we're also helping them hopefully prevent any future problems during and after pregnancy as far as pelvic floor dysfunction goes. We're helping them either prevent or treat it. I think that understanding also, again, what's happening with their hormones, and that we are available, or trainers, fitness professionals, and medical professionals alike are hopefully available to start screening their clients to understand really what's going on with them physically, as well as being proactive in understanding if there's anything that's happened with them mentally, so we can help with any kind of issues with, the hot topics right now with mental depression and things like that. We want to be on top of that. So I just think it's a really exciting topic to cover. It's so vast, but I think we pretty much nailed everything and talked about the myths. And thank you for having me.
Yes, absolutely. Always fun to talk to you. Thanks so much for being here. And fitness pros, health coaches, if you have a question that I missed, please leave it below the show link. And that'll be fitnessmarketingmastery.com/ pregnancy. And I would appreciate it if you would leave a rating in iTunes. It really helps. Check out today's show notes for more on connecting with Danielle and resources. We will put the medfitclassroom.org link specifically where other courses are listed, and that'll be the kind of here's where to watch spot. So along with that, you can find other blogs and other podcast episodes at fitnessmarketingmastery.com.